Hi, thanks for tuning in to episode number 86 of the Doctor Podcast Show. And I'm your host, Dr. Robert Syker. Today, we're going to have a great guest. Did you ever wish that you had X-ray vision and could see through things? Many people do, but interestingly, I'm an ophthalmologist and I take informal surveys of my patients occasionally and ask them, would you want to have X-ray vision? And surprisingly, only about 50% or half of people actually want to have X-ray vision. The rest are not interested in that and don't want to have vision like Superman. Today, we have a very fascinating guest who will discuss how we can see through living organisms without X-rays and without the radiation that X-rays give off. So this will be very exciting and interesting to watch. Our guest is Dr. Zihao Ou. He's an assistant professor of physics at the University of Texas in Dallas. He received his bachelor physics degree at the University of Science and Technology in China. He then received his Ph.D. in material science and engineering at the University of Illinois at Urbana-Champaign. And he was a postdoctoral scholar after getting his PhD at Stanford University for 4 years, from 2020 to 2024, where he did a lot of this research. And currently he's at the University of Texas. So, Dr. O, thanks for taking the time today from your busy schedule to join us on the Doctor Podcast Show. This is very interesting. I
Yeah, it's
read
my great
some
honor to be here. Thank you so much for the invitation.
Yeah, it's my pleasure. This will be very interesting and exciting. You recently published a remarkable paper in the journal Science, very prestigious journal, on how to make skin invisible in mice so that you can actually see through their skin, see their muscles, their bones, their
Mhm.
blood vessels, their ligaments, their tendons, intestines, and other abdominal organs, which was incredible. Tell us how you got interested in materials science and eventually got your PhD in that and engineering as well. And that led to this amazing discovery that you made. How did you get started in that?
Right, right. Thanks for asking this. So, in my career, when I was young, I'm always envisioning like why we are different from the outside. So, my vision is that we can move around. It's all because we are able to look for food when we feel hungry, we look for shelter when we feel dangerous. And this is because we can dynamically move around. And our capability to move around is actually achieved by the complicated cellular movements that is also dynamics. And these complicated cellular movements are realized by the even more complicated dynamics of the molecular machines. So through my career, I've been asking myself, can I have the capabilities to visualize these movement directly using our eye or using a machine. So that's when I was in PhD, I used a special technique called liquid phase transmission electron microscopy, where we look at nanoparticle movement in a liquid environment using these advanced electron microscopy tools. So after I'm done with my PhD, I was feeling that I want to make a bigger impact, how to help the society better. And then I decided to doing biological and biomedical related research. And the bottleneck question that bothers me is that we cannot look inside what is happening inside our body. So that brings me to this work what we are going to discuss today, that we are developing a method. How can we give us a way to peek inside the body while keeping the animal alive?
That's very fascinating. Now, to
Yeah.
understand that, we
Mhm.
need to understand something
Right.
called a Kramer's chronic reaction. I'm sorry,
Relation.
Kramer's
Yeah.
chronic relation. And that's the basis of your work and research and discoveries. Now, that's a complicated physics principle, but can
Yes.
you explain it to us in as simple terms as possible? Because I'm not a PhD in physics, and most of my audience is not as well. So, tell us about the Kramer's chronic relations.
Right, right. So, although you're not a PhD in physics, but I guess when you look at, you have a chopstick inside water, you see the light actually get bent when it goes through different materials. So this is the reason why a lot of our tissues are not transparent. So although it seems that it's quite different, but actually the physics behind this are similar. So when light goes through our tissue, because we have most of us, 80% of us are made of water, and inside the water environment, there are large number of functional molecules like lipids, fibrils, and every time light faces change of materials, it will bend. So that's why light cannot go through our tissues very easily. So it is because of this refractive index. Refractive index usually, when we described it, it is the light propagation inside the tissue. So it describes the speed of light, but there's usually a component that people ignores, which is how much light actually get absorbed. So Kramers-Kronig relation basically describes how much, what is the connection between absorption and the speed of light. And these two, because they both describe the property of light propagation inside the tissue, they are correlated with each other. If you change one of them, it's going to change the other one. So that's the fundamental of our work is we try to change the absorption property of the tissue, while by doing that, we can actually change the refractive index of the tissue and leads to reduce the scattering of the tissue. Hopefully it makes a little bit more sense.
Yeah, that makes a lot of sense, especially to me as an ophthalmologist, because I,
Right.
I look through the eye. The eye is a very unique organ in the
Yes,
body, which is transparent. I can look through
exactly.
the cornea,
Yeah,
through the lens, through the vitreous, all the way through the retina. There's really no other part of the body where you can
exactly.
see into the body. So,
Right.
in essence, you've created a technique that allows you to see through opaque skin
Exactly.
in mice using this Kramer's chronic relations. That's
Right.
incredible. So tell us how you got started with this idea.
Huh?
What was it that led you to think about this project of looking through otherwise opaque body tissues?
Yeah, that's an interesting question. So a lot of times, when we after we published it, this work get commented by a lot of uh, media, including Saturday Night Live. So when they are introducing our work, they are joking that it looks like scientists just eat some of the snacks, such as Doritos. They didn't wash their hands and start to do their experiments, and they find something new. This is what they describe, but actually, I wish science is that easy.
Right.
Uh, it starts from a field project, as a lot of discoveries that are made. So when I first joined Stanford, I spent a year to understand how light propagates inside biological tissue. And I try to understand the theory behind that and design experiments to prove that light propagates differently inside biological tissue and in the air. So I find some theoretical insight and try to design experiments, but I failed after a year. It is very hard to measure the light out of the tissue when they are when they have a strong absorption. So at the end of the year, we were thinking, oh, it looks like this project is not going anywhere. What else can we do? And then we look at our experimental results carefully, and we find that it seems like the scattering of the tissue is actually different. So that's the starting point where we think, oh, can we actually utilize absorbing materials to change the scattering properties of the tissue? So and then I switched gear at the end of my first year postdoc, and then everything started to, there's so much possibilities emerged after we made this change. And that's how everything happens afterwards.
Right. So you tried to find
Mhm.
solutions or dyes or chemicals that you could apply to biologic
Mhm.
tissues such as skin to make them transparent or translucent instead
Uh,
of opaque.
Right, right. Because we were guided by this Kramers Kronig relation. So we look for molecules that are strongly absorbing. And then these are the guide, we have this physical guideline that lead me towards tens or hundreds of different chemicals that are strongly absorbing. And interestingly, although this is coincidence, it seems like the target or the selection criteria of molecules overlaps with the food industry. And that's
Hmm.
one of the reasons how, in the end, the option that we optimized overlaps with what food industry or discovered. That's the
Wow.
molecule of tartrazine that we published recently.
Right. So was that an accidental discovery that you were just testing
Mm.
lots of different things, or you had this idea that this might
Uh,
work and I'll try it?
yeah, because for us, we are not randomly trying chemicals. We have these physical guidelines. So at the beginning, I was trying a lot of absorbing molecules. Um, I bought from the chemical companies. But there's one day I was thinking, oh, should I actually try the food chemicals in the food? And then I wrote an email to the largest company in the US, Sensient Colors, when they are making this different kind of food dyes. And can you send me a few samples of your food dye? Let me try it in my experiment. And then that's how we discovered this dye actually works better than any of the chemicals I bought before.
Wow. That's fascinating how you got that
Yes.
discovery. How many different chemicals and dyes and solutions did you try, and how long did it take before you kind of
Uh,
almost stumbled on the food dye solution?
Yeah, so in the paper we wrote about 21, but actually tried a lot more than that. Um, so we tried probably 40 to 100 um, in our lab when we were doing this kind of experiments. So originally I was my first target or first successful trial is not the molecule tartrazine we used in the food dye. It actually turns the tissue more towards red colors and then it seems, but it gives us confidence that these physical principles could potentially work. And later, that's what I mentioned when I started to think, can the food dyes actually work better? That's why I got to the food dye and find, oh, this actually performs better than the dye I first optimized for the experiments.
Wow, amazing.
Yeah.
Now, eventually you settled on tartrazine, which
Yes.
is a yellow dye. It's called FD&C Yellow 5, and it's
Yes.
actually approved by the FDA
Yeah.
and is used in many foods to color them a yellow color. It's sort of a lemon yellow color. It's
Mhm.
also used in cosmetics that are applied to the skin. It's also used in pharmaceuticals, and it's been around a long time. So it's a pretty safe type of dye, right?
That's what we believe because at least it has been approved for food and has been utilized in the market for decades.
Right. Now there are I did some research on tartrazine. There are some reports that there may
Mhm.
be toxic effects and some
Yeah.
literature that's not certain that maybe it
Yeah,
causes
yeah.
cancer. Is that right?
Yeah, there are definitely. So all these, I think no matter if you give a large dose, anything become toxic, even water. So
Right.
everything is dose related. So that's one. I think that you are definitely correct that large amount of toxin that could cause potential damages to tissues, even life of the animal. However, that's one aspect that we are also working on these days. Can we find better strategies? Can we even further lower the dose? Can we find another, maybe modified version of tartrazine that can be safer and more efficient? So those are all the directions we are actually trying to improving based on this original invention.
Right. Now, you mentioned earlier Doritos. Is that what Doritos use to give them their yellow color? That they're using FD&C Yellow 5 or tartrazine? Is that right?
Right. So in a lot of these yellow snacks, sport drinks, when they show this yellow color, it's usually a combination of yellow number five and yellow number six. So these are one of the most common uh, food dyes in the industry. I'm not sure about Europe, but in the US market, it's definitely widely used.
Right. So if you eat enough Doritos, does your skin become invisible?
It do require a large amount of Doritos.
More than you could possibly eat. Well, that's fascinating. So now you discovered that tartrazine or FD&C Yellow 5 does what you wanted to do. Now, how do you apply it to the animal skin? In your case, you did the experiments with mice.
Right,
Does it come as a powder, a liquid, a gel, a
right.
cream?
Yeah, so we get inspired from the cosmetic industry that we what we do is we prepare a solution of this chemical and then add a little bit of agarose gel so to increase the viscosity of this solution so that it becomes like a soft gel and we apply it to the region where we want the mice skin to become transparent to the locally, so topically applied locally on the skin, and this part of the skin become transparent. After
Wow.
that, after you're done with imaging, we can wash this away because this is a food dye. It's super soluble inside water, and you can wash it away, and skin will become opaque again.
Right. And again, the toxicity is also probably minimal
Right,
since you're applying it topically. You're not having the mice eat it or drink it or ingest it. So
right,
it's
right.
less
Exactly.
likely to have any toxicity. Now, once you apply this gel form of tartrazine to the mouse, how long does it take for the mouse's skin to become transparent?
Right. This is a because this is a chemical physical approach to make tissue transparent. So it is very fast. It happens on the order of several minutes. So it will
Very quick.
become transparent. Yep, and then it will last for about 10 to 20 minutes. And if you wash it away, it will become opaque again. But if you don't wash it, it will gradually go into the body, go through urine and feces, and it's eventually expelled out of the body.
I see. So there is some systemic absorption into the mouse's bloodstream, even though it's applied topically.
Right. If we don't wash it, I mean, even we wash it, because this dye is a passive diffusion, some of the dye will usually diffuse even even further, and it will go into the bloodstream of the mice.
Right. Now, without getting into
Mhm.
complicated physics again, which
Yes.
you're an expert in, how does the tartrazine molecule make the skin transparent? Normally, skin is opaque. Can you explain
Yeah,
that?
yeah. Right. As we mentioned before, we have the skin is not transparent. It's largely because it is strongly scattering. And tartrazine, why it has this yellow color, it is because it strongly absorbs light around 400, accurately speaking, 428 nanometer. So it is because of this strong absorption of light in certain wavelengths, it changes the refractive index of the tissue, or I should say aqueous part of the tissue in the neighboring wavelengths, and it makes certain part of the wavelengths, usually 550 or beyond, so this part of wavelengths become transparent to the light because it reduces the scattering of the light in these wavelengths.
Wow, that's pretty amazing. Now, you have some images online of the mice, and I'm going to include this when I put it online so it can be seen. And you're actually able to see intestines and liver and other organs inside the mouse, right?
Yeah,
And
right.
I think you can also see the intestinal mobility. In other words, the intestines are actually moving and moving food through the intestines. Is that right?
Yes, that's correct. Yeah. And then one unique part about our method is that it is invisible. So you can actually check this by our eye, or you can capture this using a phone instead of relying on expensive machines like ultrasound.
Right.
Yeah.
So this takes the place of ultrasound, which is used, and also potentially X-rays.
Right, right. I think that's what we envision this technique. It won't replace those techniques, but it's definitely another alternative strategy, especially in developing countries where expensive machines are at very limited access.
Right. Now, I understand you also applied this to the mouse's head and were
Mhm.
able to see into the brain of the mouse. Is that right?
Yes, we look at the vessels on the surface of the brain.
Does the tartrazine penetrate the skull, though? I assume there's a bone
Uh,
tissue that protects the mouse's brain. Were you
yeah.
able to make that transparent as well?
So we didn't try to emphasize we make skull transparent because we believe skull is more like a natural barrier that actually protects the molecules diffuse into the brain. However, for mouse case, the skull thickness is not very huge, so it's hundreds of micron thicknesses. So actually, once we make the scattering of skull, on the other hand, is very strong. So once we clear the skull, we can visualize the vessels on the brain.
Right. So if the bone tissue that you're looking through is very thin, then potentially you
Yeah,
could see through that as well.
right.
Now, this again is amazing and
Mm,
fascinating to me, and I'm sure the audience. I'm sure you've been thinking about human applications
exactly.
for this. Tell us about some of those.
Right, right. Because this technique makes tissue transparent, it has obvious applications in human, especially in diagnosis and potential surgery for treatment. And however, for currently, the biggest difference between human tissue and mouse tissue is it's not the composition because biology they are actually similar, but the geometry are very different. So human skin it's depends on locations. It could be 10 times thicker than the mouse skin.
Hmm,
So if the thickness is so high, then fusion of this molecule into the skin become a challenge. So that's why engineering method, how can we deliver these molecules more efficiently into this human skin is something could potentially make it easier to translate this technology towards clinical applications.
I see. That's interesting.
Yeah.
Interestingly, the
Mhm.
eyelid skin, the skin of the upper eyelids, is the thinnest skin in the human body.
Yeah.
So it would be interesting if you put some of this on upper eyelid skin, and that might enable you to see the muscles and other tissues that are in
Uh,
the upper eyelids. And
Yeah.
since the
I see.
tartrazine is relatively safe or very
Yeah.
safe, you might be able to do some clinical trials with eyelid skin and see
Yeah.
how
Yeah.
that works.
Yeah,
Uh,
that sounds like a great plan, actually. Thank you.
yeah,
Mm,
check that out. Human eyelid skin is actually
mm,
very thin. Now, is
mm.
there a possibility in other parts of the body where the skin is very thick? For example, in the
Uh,
legs or arms. What about if you inject the tartrazine into the skin using a microscopic needle? Would that bypass the problem of the
mhm.
human skin being too thick?
Right, it will. It will. I think that microneedles are one way to increase the penetration of these dyes. Right, we are hoping that there will be a more robust method to deliver this um, into an area we want in a more controllable way so that we can bring this to clinic easier.
Yeah, this would be extremely valuable for surgery.
Yeah,
For example, if an orthopedist is doing surgery on an
yeah.
elbow or a knee, if
Uh-huh.
they could see through the skin, they could see
Right,
better what the problem was, and they could better plan what kind of surgical approach they need. Currently, they use CAT scans, X-rays, and MRI scans.
right,
But this would be a real live look into the tissues in real time. So that would be very valuable.
right.
Um, what about other practical applications? Have you considered any other ones?
Um, there are also, apart from biomedical applications, there are also new designs in materials, but those are more engineering designs because we are actually offering a new strategy to play with this refractive index. So we are also looking for other applications. How can these materials, and as a new material itself, how can we design some optical components like lenses or optical filters. These
Hmm,
are made of fluids so that it may be easily applied for some unique applications.
right.
Mhm.
Have you applied for any patents on this process or technique?
Right. We have an original patent on this, how we use this Kramers-Kronig relations to change the refractive index and for biomedical applications. But I feel like because there are so many potential opportunities in the future, and there will be a list of patents following that.
Right. Yeah, there are many applications that I'm sure will
Right.
come up as more
Yeah,
people get involved in this research.
that's right.
How's your professorship at University of Texas in Dallas working out?
Mhm.
I know you just moved there recently from being at Stanford for 4 years.
Right, right. So I was very fortunate about this opportunity because I'm in the Department of Physics, but I'm hired by a cluster hire in our school, in the School of Natural Science and Mathematics, through a cluster hire for biomedical science. So this biomedical science program is very unique because it emphasizing physics, chemistry, and mathematics behind biology science. So I wish people from physics, chemistry, and mathematics will work together to resolve challenges in the biological science, which is I feel that is such an opportunity that matches with my background. And
Yeah,
yeah, since I was trained as a physicist, I always have this motivation to study fundamental science, and this opportunity gave me a unique chance actually to pursue pursue the direction I want and continue my passion on fundamental science.
that's great. So you basically have a team effort there and people who have uh, tremendous expertise in other sciences and
Right.
mathematics that can help you. Sounds fantastic.
Yeah, exactly. I'm very excited. I have been very lucky, I feel, to get into this. And we are setting up our lab in the past semester, and things are gradually coming close, and we are producing new results now.
Right. A lot of work involved.
Yeah.
Well, I wish you lots of success in your future ventures. This is an extremely important discovery, which I'm sure will lead to huge benefits for many people. So I want to thank you for doing the work to find this out. And I also want to thank you for taking your time today to tell us about it. It's very fascinating.
Yeah, thank you so much for this opportunity, and I'll keep you posted on my
Okay.
future discoveries as well. Yeah, thanks for also for the suggestions for the applications, especially the eyelid.
Yeah, the eyelid skin is very interesting.
Yeah.
All right. Well, thanks very much and have a
Mhm.
good day.